I'm Michael Doherty. I'm a rheumatologist in Nottingham in England, and one of my key interests is gout. Gout is the commonest inflammatory joint disease, the commonest arthritis where you get inflammation in the joints. And it's getting more common. In England, for example, at the end of 1990s, the overall frequency in the population was 1.4% of adults. In 2012, it had gone up to 2.4%. Very, very marked increase. The two main reasons why it's going up worldwide is that we're living longer, and gout is an age-related condition. It's more common as we all get older. And secondly, we're getting bigger. And when you get overweight and obese and get problems with blood pressure and diabetes, it's all called metabolic syndrome. And a high uric acid level that leads to crystal formation is part of metabolic syndrome. In terms of diagnosing gout, the main way patients first know they've got it is they develop the worst pain they've ever had in their life that comes on dramatically fast, often within 6 to 12 hours of first knowing there's a twinge of discomfort or pain in your joint. Within 6 to 12 hours, you're at the worst. Same level as childbirth or having kidney stones. And it's really severe. It then levels off for a day or two and then gets better on its own, even without any treatment, within 1 to 2 weeks. It very often goes for joints of the feet, knees and hands, the joints at the ends of our limbs, which are cooler, and probably that encourages crystals to form. Luckily, we know a lot about gout. We know that it's caused by sodium urate crystals that deposit in and around the cartilage of your joints. And we know that you only get urate crystals when your uric acid levels are above a certain critical level. It's called the saturation point. If the level goes above that, it's physically possible to form sodium urate crystals. Now, if your level is persistently raised, over a number of years, it's not a quick process. You, every day, are slowly depositing more and more crystals. And they form preferentially in cartilage in the extremities. And these little crystals are sharp needles. They're very hard, and they form in cartilage and other tissues, and crystals then start to stick together, and new crystals grow on the ones that are there. So you end up with these very slowly expanding lumps of hard crystals in your tissues. And that can end up damaging your cartilage and bone and causing arthritis. If you get to that stage, apart from having acute attacks that come and go, you may also end up with irreversible joint damage that causes daily regular pain when you're using and moving your joints. So they're the two worst things for the arthritis problem: acute attacks and chronic joint damage. And that joint damage normally comes later. Now, in terms of managing gout, we know lots of risk factors that push your uric acid level up. And an important one is what you've inherited from your ancestors, from your parents. And some people are born with naturally inefficient kidneys that have trouble getting rid of uric acid out of your body. We make uric acid every day, and most of it comes from our own body's production of breaking down chemicals called purines, and the end thing that can't be broken down is uric acid. So that has to be got rid of out your body, and most of it goes out through your kidneys. A little bit goes into your bowel. So if you've got inefficient kidneys, it's not long before often your uric acid level starts to go up. Other things that affect kidneys, like chronic kidney disease, or lots of tablets for blood pressure and other conditions, they can all reduce the kidney's excretion. If you get overweight, your body mass goes up and you make more uric acid. It's as simple as that. And it's the most important thing about diet is how big your body is. It's the amount you eat rather than the specific things that you eat. Some foods do have a lot of purines in them that can then get broken down to uric acid. But you really do have to be going and eating a lot, going for it, eating a lot of these high purine foods before they make a big difference. Alcohol is often blamed as the main reason why people get gout. And if you do, again, drink a lot of beer and a lot of spirits, that can push your uric acid levels up and give you gout. But it is excessive drinking rather than just regular, ordinary, safe level drinking. And wine is neutral. It doesn't affect your uric acid at all, luckily. Now, when it comes to diagnosing gout, often just the acute attacks are sufficiently characteristic that you can diagnose it. And lots of general practitioners will make that diagnosis purely on that. Finding then a high uric acid can help support that, but 100% confidence actually requires sticking a needle into a joint, or sometimes you get lumps of crystals under the skin that you can see, very disfiguring and embarrassing. You can stick a needle in those, they're called tophi. And then you can look at under the microscope and identify these crystals. That gives you 100% confidence you've got the diagnosis. Now, in terms of managing gout, the key thing is to get it diagnosed. As soon as you've had it diagnosed, you should ask your doctor, what are the treatment options to get rid of it? Often doctors wait until you've had lots of recurrent acute attacks. They focus on the acute attacks, and the first time you have one, and it'll settle, it may be another 6, 12, or even a couple of years before you have your next one. But if nothing's done about it, and you've got raised uric acid levels all the time, they'll just get more and more frequent and spread to involve more joints. You only present with gout when you're stuffed with crystals, lots of crystals, and some of them just spill out of the cartilage into the joint fluid, come in contact with the soft lining and cause vicious inflammation. But if nothing's done about gout, you get recurrent acute attacks and then joint damage. High uric acid is also bad for your heart and your kidneys. It increases the likelihood of heart disease and strokes, and also chronic kidney disease as well. So apart from treating the arthritis, which is horribly painful and potentially damaging, high uric acid increasingly is being accepted as something we should consider treating for your heart and your lungs, your heart and your kidneys. Now, the simple principle is, if you take a tablet that brings your uric acid level down, allopurinol is the commonest one used in many countries worldwide, but there are others. Allopurinol reduces your production of uric acid. And if you bring the uric acid level down below this critical level, the saturation point, two things happen. Firstly, you can't produce any new crystals. All the ones you've been making for years, that production stops. The second thing is that the lower the uric acid goes below the saturation point, the more it can actually dissolve away, slowly dissolve away the crystals until you've got no crystals left in your body. Now that takes 1, 2, or 3 years, depending on how low the uric acid level has gone. But that leads to cure. You've got rid of the pathological crystal that is causing the joint damage. Now, lots of people don't end up being on urate-lowering therapy. So ask your doctor, can you please explain to me the pros and cons of having a tablet that may reduce the uric acid level and make me better? And just push them.